Babette.
Ricky.
James Harvey.
Ricky 2.
Lily. Good afternoon. Thank you for coming to my informative speech on PCOS. PCOS, what is it? Well, PCOS stands for Polycystic Ovarian Syndrome, and it is an endocrine disorder that affects between 5 and 26% of women worldwide. There are several different ways that you can be diagnosed with PCOS. PCOS doesn't just affect your body on the inside, but it affects your body on the outside. One of the ways that you can be diagnosed with PCOS is by getting your hormones tested at your gynecologist. What hormones are they looking for specifically? Well, they are looking for excess androgens, which are a hormone that the body produces. Most women, their body produces a lot less than a man does, but in women with PCOS, their body produces more than the typical woman should. Another way that you can be diagnosed with PCOS is by getting an internal ultrasound. On this ultrasound, they are looking for images like this. Notice on the left we have pictures of normal ovaries, but on the right we have images or scans of ovaries that present with PCOS. You'll notice these little sacs on here. These are called follicular cysts. In order to get a diagnosis this way, each ovary has to present with 14 or more follicular cysts. This type of diagnosis manifests itself more on the inside than the outside. So you don't just have to have outward symptoms, but you can also have inward symptoms. What is a follicular cyst? It is a fluid-filled sac that used to be an egg. So it is an immature fluid-filled sac on a woman's ovary. You also have to have the characteristic of an irregular menstrual cycle. So this means that you don't have a period every single month. If you're experiencing these types of symptoms, it might be worth talking to your doctor about. Most women don't get diagnosed with PCOS until they're in their 20s or their 30s, and that is because it can be harder to diagnose. A lot of younger girls don't feel like they should speak up about what is going on in their body. Some of the symptoms of PCOS include excess hair growth on the body. That includes your face, your chest, your armpits, and your legs. Most women with PCOS also have excess acne on their body. So again, face, neck, chest, and back. A lot of women with PCOS have dark patches of skin, usually on the back of their neck or the back of their arms. And the most common symptom of PCOS is irregular menstrual cycles. Why does PCOS cause irregular menstrual cycles? Because you don't ovulate every month. And what is ovulation? Ovulation is a time of the month in a woman's cycle where the egg drops and they're at their most fertile. If you don't ovulate every month, then you don't drop an egg. And if you don't drop an egg, then there is no chance to have a normal menstrual cycle. PCOS is the leading cause of infertility in women because it stops ovulation. How can PCOS be treated? It can be treated through different types of birth control, such as the IUD, patch, implant, which goes in your arm. It can be treated through the Depo-Provera shot or the normal birth control pill. You can do medicines to help control insulin resistance, which is a part of the disease as well, such as metformin, or some women decide to get on androgen blockers. PCOS doesn't just affect women at an early age, but it can affect them later in life as well. PCOS puts women at a higher risk for all types of female reproductive cancers, such as breast cancer and uterine cancer. It has also caused women with PCOS to have more miscarriages. They are prone to miscarriages. Women with PCOS also face infertility because they do not ovulate. PCOS isn't just a disease that should be overlooked. PCOS is important and it matters. A lot of the time in this world, there's a stigma around a woman's period that it shouldn't be talked about, that the things that we go through shouldn't be talked about, but it should be. PCOS can cause increased pain and discomfort during a woman's cycle that others may not face. So next time, when a loved one of yours is complaining, maybe don't just sit here and dismiss it as, oh, they're just a woman, that's what they go through. Because you never know what they may be facing on the inside or the outside. They could have a condition that they maybe don't even know about yet. But I guarantee you actually stopping to ask the question will show them that you care. Thank you for coming to my speech today. I hope y'all enjoyed it.